Nutrition. It's the science of optimal cellular metabolism and its impact on health and disease. The nurse's role in nutritional assessment includes monitoring and interventions to clients needing acute and chronic nutritional care, incorporating family nutritional habits into their care, and being an active role model in community teaching regarding nutrition. The scope of nutritional problems goes from one extreme to another of malnutrition. Your optimal nutrition in the middle includes all nutrients that are available in balanced amounts for cellular metabolism and physiological function. Suboptimal is either insufficient or excessive quantity or quality of macro and micronutrients, which is the malnutrition on either end of the spectrum. Poor nutrition negatively impacts health, and poor health negatively impacts nutritional status. Be sure to review the anatomy and physiology of the digestive system if you are unfamiliar with it. Also recall that normal digestive starts with mastication and swallowing, and also recall that immunity begins in the intestine. What is malnutrition? It's the condition that results from taking an unbalanced diet in which certain nutrients are lacking, either in excess, too high, or in too low of proportions. There are a number of ways that you can have malnutrition: protein deficiency or excess, carbohydrate deficiency or excess, essential fatty acid deficiency or excess, vitamin deficiency or excess, and mineral deficiency or excess. Malnutrition is a consequence of either too much or too little of the macronutrients or micronutrients and their specific functions. There are clinical effects of malnutrition as well, and they can include depression, immunity, risk for infection, decreased cardiac output, decreased renal function, hypothermia, loss of strength, impaired gut integrity and immunity, impaired wound healing, necrosis, fibrosis, and then also ventilation issues. Many of us, when we think of at-risk populations, think of people in third world countries. They are not the only people at risk. Individuals can be specifically at risk, especially infants and children, and especially because of their growth and development changes. Keep in mind your birth weight should triple in your first year. Infants, keep also in mind that breast is best for at least 6 months to a year. At 6 months, we can introduce solids, non-chewable, and at 1 year, small bites, but keep in mind risk for choking is great. Those that are pregnant or lactating are in need of increased carbs, proteins, fats, and micronutrients. Older adults are also at risk due to decreased ability to ingestion, absorption, and metabolization. Decreased saliva production also occurs in the older adult, as well as decreased sense of taste. Be sure to check teeth and fitting of dentures. Those populations at risk include either the extreme young or extreme old, pregnant women, specific ethnic or races, poor and underserved, certain lifestyles and personal choices, and those with underlying medical conditions. Also be sure to review metabolism. Cellular metabolism includes hormonal and enzymatic process occurring within cells to allow protein, carbohydrates, or fats to be used for energy or made into new products or tissues. Altered metabolism can result in altered hormones affecting disease processes such as diabetes, liver disease, and obesity. Key is prevention. Be sure to review your endocrine organs and your anatomy and physiology. Also remember that metabolism is the process of biomechanical reactions in body cells that produce energy, repair cells, maintain life. They also control hormones, the chemical messengers secreted by various glands, which also regulate growth, reproduction, gender differentiation, and fluid and electrolyte balance. Exemplars that we will review in class for alterations in metabolism include obesity and liver disease. In another course, you will also be reviewing the nursing process, and the first part of a nursing process is assessment. We must be able to recognize when an individual has a problem. For the assessment for nutrition, that may include history of nutritional intake, diet restriction, changes in appetite, changes in weight, their medical history, medications, and allergies. We may include screenings looking at unplanned weight changes, changes in appetite or intake, nausea and vomiting, difficulty chewing or swallowing, abdominal pain, change in bowel habits such as constipation or diarrhea. Earlier I had said that macronutrients have very specific functions. This graph explains those functions and the effects of deficiencies or excess. Proteins manufacture other proteins and enable tissue growth and repair. Carbs provide energy for the proteins to do its work. They also provide glucose for the brain, neurosystem, and red blood cells to function. Fatty acids maintain integrity of the phospholipid-based cell membranes. This chart also looks at the consequences of deficiencies or toxicities of common vitamins and minerals. For instance, zinc and folic acid helps in the production of proteins and cellular structures needed for growth and repair. This chart reviews key findings and reasons for deficiencies of minerals, fatty acids, proteins, carbs. Chronic disease related to malnutrition can occur, and examples of that would be sarcopenic obesity and pancreatic cancer. Starvation can be also occurred related to certain diseases or exemplars such as anorexia nervosa, burns, or trauma. To be underweight, your BMI is less than 18.5. Those with excess nutrition would have a BMI between 25 and 29.9. For obese, there are 3 different classes, and the lowest class is a level 1. That BMI would be greater than 30. Child obesity actually compares children to percentiles on growth charts, and an obese child would have a BMI greater than the 95th percentile on a growth chart. Here are more examples of excess and toxicity due to biotin, vitamin C, and vitamin D. Key underlying medical conditions that affect nutrition could include those that are related to impaired oral intake or impaired digestion and absorption. Some exemplars are in each of those columns here, such as impaired oral intake would be poor fitting dentures, cavities, cleft palates, stroke if they have swallowing effects, Parkinson's if they have swallowing issues, as well as mental health disorders and dementia and Alzheimer's. Impaired digestive and absorption issues would include lactose intolerant, gastric surgery, inadequate gastric acidity, and medication use. Here are a few more examples, such as increased metabolic demand. Those diseases would include COPD, cancer, Parkinson's, trauma, burns, and stroke, or altered organ function, such as acute or chronic renal disease. Here are some exemplars within malnutrition issues: bulimia nervosa, pernicious anemia, and stroke. The 2 that we're going to cover within our classroom work would be obesity and protein-calorie malnutrition. Protein-calorie malnutrition will fall under that liver disease. There are common diagnostic tests for many disease processes. For nutritional issues, they may include laboratory tests such as albumin, blood glucose and hemoglobin A1C, lipid profile, electrolytes, and hemoglobin and hematocrit. So for instance, albumin measures circulating protein in the blood. If it's low, you have a protein calorie malnutrition. Inflammation and blood loss, fluid status can also cause low serum albumin levels. Your pre-albumin laboratory work would also show some dietary protein intake issues. Blood glucose and hemoglobin A1C is looking at hypoglycemia. Hypoglycemia would be inadequate caloric intake, and hyperglycemia may be an indication of diabetes mellitus. Hemoglobin A1C shows average blood glucose over time and is used to manage diabetes. Anemia or renal disease can cause false A1C readings. Lipid profiles, that would be looking at and reviewing cardiovascular disease. So within the lipid profile, we may be looking at LDLs, which is low density lipoprotein, or HDLs, high density lipoprotein, cholesterol, and triglycerides. Triglycerides reflect your hyperinsulinemia, and new diagnosed type 1 diabetics may have temporary elevations of triglycerides. Keep in mind, LDLs are the bad and HDLs are the good. Electrolytes, we may be looking at sodium, potassium, calcium, magnesium, and phosphorus, which all can become imbalanced with inadequate dietary intake or many other conditions such as renal and liver disease and diabetes. Hemoglobin and hematocrit looks at red blood cells to diagnose anemia caused by dietary deficiencies such as iron or vitamin B12. It also provides information about the hydration status of a patient. Once we've made key nursing diagnoses, which we'll talk about a little bit in class, we will then determine the appropriate interventions to optimize that patient's health. Interventions may include putting in a referral for a dietitian or a nutritionist. We may be looking at menu planning, basic therapeutic diets such as low salt for hypertensive patients or low fat for heart disease patients. We may look at calorie reduction for obese patients. Consumption of fiber increases your stool bulk and may decrease blood cholesterol levels. Gluten-free would be key for celiac disease. And we may even look at fatty acid intake such as omega-3 and omega-6 for dry, flaky skin and eczema. Sometimes we need to go beyond therapeutic diets and include either enteral nutrition or parenteral nutrition. Enteral nutrition is nutritional support via tube feedings, and individuals in this case are usually unable to eat or swallow but have an intact or functional GI tract. Feeding tubes are inserted directly into the stomach or small intestine for delivery of enteral feedings. The feeding is then administered either by gravity or a feeding pump through a PEG tube or an NG tube or a percutaneous endoscopic gastrostomy, which is your percutaneous endoscopic gastrostomy is your PEG tube. We may also need to look at parenteral nutrition. This provides either total or supplemental nutrition intravenously. Patients then have intestinal failure and cannot be fed orally or by enteral feedings because their GI tract is not working appropriately. This nutrition contains glucose-based IV solutions with electrolytes, minerals, and amino acids. Fat emulsions or lipids may be included or administered as a separate solution. These are used for patients unable to process nutrients via the GI tract for more than 4 or 5 days. Peripherally or centrally it can be given. At risk, when we do this, patients are at risk for sepsis, and electrolyte and metabolic imbalances. We also will always regularly check their blood sugars because of the glucose that's within the solution. Some other common strategies for collaborative interventions might be surgery. For our obese patients, for instance, we would have bariatric surgery. These patients may be at risk for micro or macronutrient deficiencies. Common procedures would include a Roux-en-Y gastric bypass or a lap band procedure. Pharmacologically, we have medications that we might include, such as supplements, iron, multivitamins, maybe protein and nutritional supplements such as Ensure. Statins is a type of drug group that we use to treat lipid and cholesterol reduction needs. And then we may also look at key agents to control glucose levels for our diabetic patients. When we look at interrelated concepts, keep in mind they may include things such as acid-base balance, glucose regulation, immunity, tissue integrity, growth and development, culture, perfusion, oxygenation, and stress and coping. There's also a few others that are within this graph.